On behalf of all assembled here today, I should now like to invite Dr. Bonnie Adamson to address Convocation.
Good morning. Thank you, Chancellor Cowan, President Chakma, my nominator, Dr. Jim Weiss, faculty members, graduates, and distinguished guests. Congratulations, graduates. You should be so proud of your accomplishments, and it is a privilege to be here with you. I am deeply touched to receive this honorary doctorate from Western and feel privileged to be sharing this experience with you. It is all the more meaningful coming as it does from my alma mater, and I can assure you it is a highlight of my 50-year career in healthcare. I began my journey as a bedside nurse and was fortunate enough to spend the last 16 years as a hospital CEO. And as I look back on that time in healthcare, I'm reminded that a successful and fulfilling career is never a solo activity. It requires mentors, colleagues, family, and friends. And I have family and friends here today, and I am grateful for their support, encouragement, and understanding that they have unfailingly offered me over the years. And the greatest support and encouragement in my career and in my life came from my late husband, Bill. And so, I dedicate and share this honor with him. Now, let's talk about you, which is what today is all about. This is one of the most memorable days of your lives. The academic robes you are wearing signify your hard work. They are a celebration of your accomplishments, and they signify the opportunities that await you. Please accept my sincere congratulations for your success and for entering the healthcare professions, because the difference and impact you will make in the lives of others will be profound. So be proud to be a healthcare professional. Be proud to be a Western grad. Be purple proud. I want to begin with a story. One day, a few years ago, about 10 one morning, I was walking through a very busy hospital emergency department with stretchers and sick patients everywhere you could see, in the rooms and in the hallways. I was stopped by a patient who was in obvious distress. And before I could introduce myself to him, he said to me, "Oh, you must be the new boss here." I said, "Well, I work here." He said, "No, I recognize your picture from the paper." Then he shared his story with me. He was in his late 60s with terminal cancer and had returned to the emergency department the previous evening around 8 because his pain was intolerable. He had not been seen by a physician until 5:30 in the morning. And when I met him, he'd been in the hospital since arrival and felt ignored and disregarded. A night nurse had suggested to him to take the pills he brought from home as he kicked the bag of pills at the end of his stretcher. "I might as well have stayed home," he said. And with obvious despair and tears in his eyes, he grabbed my arm, squeezed my hand, and begged me to make things better for patients. And I promised him that I would do my very best. This story exemplifies 4 themes that, from my experience, are central to a successful career in healthcare, whatever the discipline, whatever the setting. And what I hope will illustrate to you the critical role you'll each play in impacting the patient experience, which is truly the heart of healthcare. And those themes are accountability, courage, compassion, and leadership. I'll begin with accountability. It is a very great privilege in life to be a healthcare professional. And with that privilege comes accountability. Accountability to the patients and families you serve, treat, advise, and for whom you advocate. You're accountable to serve with kindness, compassion, humility, and respect for their dignity. And as you already know, there will be highs and lows. There will be times when your heart aches for patients and families. There will be times when you share their joys and successes. There will be times of tears and great frustration. And there will be times when you think you have absolutely nothing left to give. And there will be times of tremendous satisfaction and accomplishment. And through all of that, you remain accountable to the patients first that you serve. Now, what about courage? Being a healthcare professional takes considerable courage to do what is right and what is necessary. As John Wayne said, and I quote, "Courage is being scared to death, but saddling up anyway," end of quote. I know this to be true from personal experience, as do those who worked at North York General Hospital in Toronto in 2003. That's when the deadly SARS epidemic hit, and it hit very hard at North York General. It was an unknown, lethal virus silently attacking patients, physicians, staff, family members, visitors. It made many sick, and it killed others. And in the midst of the SARS crisis, as CEO of the hospital, I called a staff meeting in the cafeteria to plead to staff and volunteers who were not already working in the designated clinical SARS areas to leave where they were and go to care for these SARS patients. In effect, I was asking them to put themselves in harm's way, and many did. And they did so with fear, but more importantly, they did with courage. And to this day, I remember exactly what one staff member said to me after that meeting. We were standing at the elevator, and she said, "You know, Mrs. Adamson, I don't mind dying because I work at North York General. I hear you, and where do I sign up?" That is courage. Let us next consider compassion. Compassion is a human response of kindness and empathy to the suffering of any kind of others, and an attempt to alleviate it in some way. With compassion, there is no judgment and there is no bias. Genuine compassion creates positive patient experiences, and we demonstrate compassion by being the caregiver we would want for our loved ones and for ourselves. Because patients expect healthcare professionals to have comprehensive knowledge, expertise, up-to-date skills, and to offer the most effective treatments. But what patients and families appreciate are the attitudes and sensitivities to their concerns and needs. In other words, what they will remember most is how you made them feel. What you say to patients and families, how you treat them, how you listen, has great meaning. They listen to every word you say, and those words can have significant impact on their lives. So if you remember that healthcare is an emotional journey as well as a physical experience, you'll be more likely to deliver compassionate care. I learned this firsthand. For more than 2 years, I helped my husband, Bill, navigate his way through the healthcare system while he valiantly battled cancer. And it was during that time that I returned to my nursing roots and had the most important and stressful job I'd ever held. It wasn't until I was no longer a CEO but a caregiver to a loved one that I truly understood the devastation and the emotional roller coaster that is triggered by a life-changing diagnosis. And during the last years of our life together, I learned more about patient and family experience than I did during my entire working life as a critical care nurse, health executive, and CEO. When you are on the receiving end, you learn the small actions and sensitivities make a positive and lasting impact. A kind word, a personal touch, can lift the spirits of family members and patients more than you ever know. When I reflect on my time caring with Bill, I vividly remember specific nurses and physicians for their sincerity, kindness, and genuine concern for our well-being. One caregiver stands out particularly as he stared directly and said, "Make the time you have together the very best it can be." Their remarkable compassion gave us the courage to move forward. Your compassion, or lack thereof, will often be what most influences patient experience. Now, leadership. Canadian author and motivational speaker Robin Sharma states that, and I quote, "Leadership is not about a title or a designation. It's about impact, influence, and inspiration," end quote. Impact by getting results, influence about spreading your passion, and inspiring others to go to places they would never go on their own. Inspiring excellence in others. Leadership is all about relationships. It's not always about having the right answers. It's about engaging and empowering others so they can be motivated to be the best they can be. Think of yourselves as leaders, whatever your title or role. Identify your passion. Be crystal clear about your purpose. And whatever the leadership role, either direct care of patients or farther away, all are important and interdependent. Now, you have heard that the only constant in life is change, and that is so true in the healthcare system. Effective leaders must be effective change leaders. And the healthcare landscape is dramatically changing. Integration, collaboration, technological change, and the rapid emergence of artificial intelligence are just a few examples. Welcome and lead the change, but never let go of the personal touch. You have probably had mentors who helped you get to where you are today. Become a mentor to others. Develop a supportive network, both personal and professional. And never stop learning, because continuing education is your best friend and a cornerstone of a successful career. In closing, I would like to reiterate how grateful I am for this significant recognition and honor. It is greatly appreciated, and I thank you most sincerely. We are all blessed to be here today, blessed to have our healthcare system, blessed to have the opportunity to graduate from this outstanding university, and blessed to be healthcare professionals. Much like that dear patient in the emergency department I mentioned earlier, be inspired by patients, learn from them, listen to their concerns and do something about it. Lead system change so it's better for all, and care for each individual with your head and your hands and your heart. That is why we do the work we do. That is why you chose healthcare. That is why you chose Western. And as you stand on the brink of your very exciting and profoundly important careers, filled with hope and energy and enthusiasm, talent, and boundless possibilities, I urge you to go forward as the next generation, embracing the challenges ahead with determination and grace. Be accountable, be courageous, be compassionate, and be the very best leader you can be. Because time is short. In fact, life is short. And the patients and families you serve are counting on you. Are you up to the challenge? I know you are. Will you do it? I know you will. Enjoy your upcoming journey. My very best wishes for good health, happiness, and a rewarding career always. Thank you for having me, and good luck.